Sam here, and I'm sitting down with Dragonfly's Joe Simic to talk a little bit about yoga therapy today. So Joe, what is yoga therapy?
Good question. So a yoga therapist works one-on-one privately with a client using yoga techniques to address specific conditions.
Okay, so how is that different than a regular yoga class?
Good question. At Dragonfly, we have group yoga classes. We love group yoga classes. They're important. But with yoga therapy, we really want to, tailor the practice to the individual. So if somebody comes in with anxiety, one, they might not even be able to come into a group yoga class. But two, if they come into a really power-based yoga class that's really vigorous and intense, it probably isn't going to really help their anxiety.
So what kind of techniques do yoga therapists teach their clients?
We really use the full spectrum of what we consider yoga. So in the West, we think of yoga as a physical practice, and we of course use physical postures in yoga therapy. Oftentimes it's combining movement with breath, but it's not just the physical. We will use seated breath work, we'll use chanting, we'll use philosophy, we'll use meditation, whatever really suits the condition.
So what kind of conditions do you work with?
Really anything can benefit from yoga therapy, but that said, we're really probably working with issues that are chronic. So if somebody comes in with a sprained ankle or a broken leg, obviously we're not going to be able to help them, but we might be able to help somebody who has, chronically sore knees from running. So within, those conditions, it's really anything from the mental to the physical. So on the mental side, anxiety, depression, PTSD, addiction. On the physical side, those chronic issues like frozen shoulder, sciatica, plantar fasciitis, arthritis, things like that.
Very cool. Can you give me an example of how you might work with someone with a physical condition?
Sure. So let's take one of those I just listed. So arthritis, at first glance, very much a physical issue, right? You have inflammation in the joints. So we're going to do some physical stuff that, helps the joints work properly, helps the muscles around the joints work. But it's not just the physical, right? Yoga therapy is a holistic approach. So we might think about breath work. In yoga, we think about it as energy. So that inflammation is like a fire energy. So we're going to want to balance that fire. And then we could take it even further and think about it mentally, right? So arthritis is a tough condition, right? Every day there's pain. It goes on and on and on. So working with the client to sort of, with some philosophy, to sort of change their outlook and think about how they can really alleviate their future suffering.
So how about a mental condition?
Mental condition. So anxiety and depression are common ones. Within that, something like PTSD, right? Post-traumatic stress disorder. Working physically, right? As my teacher would say, we want to let the air out of the balloon very slowly with trauma. So moving easy movements, right? With breath, seated breath work that moves the body into a rest and digest state more often. With the mental, we might use chanting, right? Assuming we're not triggering the client to bring in a positive thought and to move those negative thoughts out. And then ultimately with PTSD, something like meditation is going to be key eventually to fully rewire the subconscious to move past the traumas.
Right. So how does this yoga therapy process work?
So it like I said, it's one-on-one. You would come in, a client would come in, we would have an intake session, right? This is a time for us to get to know each other. There's also if it's a physical condition, there'll be some physical assessment, right? Moving around, finding out what's weak, finding out what needs to be stretched. I can't stress enough that it's a process of education, right? So it's my job to educate the client with these yoga techniques so they can go home and they have something to do, right? We really want to empower the client to sort of take their health into their own hands and do things at home. So that looks different for different people. After that first intake, we might have another session. You'll learn the techniques, you'll go home, you'll come back in a few weeks and we'll assess. Sometimes we meet more frequently, but it really depends on the condition and it really depends on the client's needs.
Nice, thank you. So how would someone contact you if they're interested?
Yeah, the best place to check us out is at dragonflyyogastudio.com. We have a page there for yoga therapy, talks a little bit about what conditions often benefit. It has ways to contact us. You can call, you can email. We'll have a little discussion about what it will look like for the client, and we can go from there.
Sweet, thank you very much.
Thank you.